welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Rate and review the show at kevinmd.com/rate. Subscribe at kevinmd.com/follow. Today in the show, we have Carolyn Stern. She is a family physician. She wrote the Kevin MD article, Practicing Medicine as a Deaf Physician is an Uphill Battle. COVID makes it worse. Dr. Stern is deaf, and we are accompanied today by Brittany Best, who is an American Sign Language interpreter. Carolyn, welcome to the show.
Thank you, Kevin. It's really nice to be on the show, and it's an honor. So thank you very much.
So we'll get into your article in a little bit, but first off, just share your story and journey to where you are today.
I was born deaf because of German measles or rubella. And at that time, they didn't know very much about rubella, but it was at the very tail end of the epidemic at that time. They didn't have the vaccine at that time. So the physicians examined me and thought, oh, I'm fine. But then around 8 months, my grandmother noticed she's not waking up when I'm going into the room, and told the doctor, can you please check her hearing? And the doc did clap, clap, clap. And of course, because it's a visual representation, I looked up and they had me do a few things, and I could read lips at that time. So the doc said, she's just slow, she'll pick up, she'll start talking later. And at that time I was 8 months. So I was already like picking up some visual cues and learning what that meant. Later, around 14 months, my great aunt blew, or had a friend of hers that was a doctor that blew a whistle. And everybody in the room jumped except for me. I was just happy playing. And the doctor said to everyone, your daughter is deaf and you need to bring her for special services, yada, yada, yada. So they brought me to an audiology clinic, and I had a severe to profound hearing loss in my left ear, and I was completely deaf in my right ear. So they fitted me with hearing aids, and my mom and my grandparents and my dad brought me to audiology, speech therapy, rehab. And I had, according to my mom, a cute auditory student who would chase after me and put like pictures on the wall, followed by the word, so that I could recognize the picture and the word. So it seems like from what I'm hearing is that I learned to read visual cues, some auditory cues, and by 2, I was reading, like window, and then write, window, and that's kind of how it went. So I got into medical school, and I applied to about 17 different universities because I wasn't sure if they would take somebody who's deaf. I put in my personal essay that I am deaf, and that it's a positive thing, that I can relate to patients with medical issues, that I will face them one-on-one for conversations, and people enjoy that. And I got into 3. I got into Northwestern, Case Western, where I went to college, and another medical school, University of the Health Sciences, Chicago Medical School in Northern Chicago. So I chose Northwestern. So Northwestern was great. To put it delicately, in my second year, they showed me a bill for interpreting services, which cost about $900 at that time for the semester. I was paying probably about $25,000 plus for medical school, room, board, and $900 didn't seem like a lot of money to me. but they said, oh, we can't provide you with interpreter services. So I went after the school and I said, you can't do that. I'm qualified. You selected me as an applicant, and that's not legal under the law, which was Section 504. It's before the ADA, which is the Americans with Disabilities Act. The result of the lawsuit, many hours on the phone with attorneys, meetings with their attorneys, and going through medical school at the same time, finally settled out of court at the end of medical school. And they had to set up an office for students with disabilities at the school. And I kept thinking to myself, well, should I bother? And I said, I need to pave the way for other students who may follow me into medical school or other programs within the university. So that was a lot of sweat and anxiety and trying to navigate through medical school. And in residency program, I chose family medicine because I couldn't find one field that I felt was worth being part of. So family medicine was great. I also needed interpreter services, but 2 months into my residency program, I had been up all night for pediatric rotation, and I was giving morning report to a group of people. And I said to the interpreter, I don't hear anything. So I'm going to check my battery. I'm going to check my stethoscope. I had a special amplified stethoscope. And I also had an interpreter who did like a 3-way. So I would talk to the patient would speak, and the interpreter would interpret. And often the patient didn't realize that there was somebody there interpreting on the phone. So that's how I communicated with physicians. So I went down to audiology and I checked my hearing, my equipment, and the audiologist said, no, it's you. You've lost the rest of your hearing. 1 week later, vertigo and tinnitus. So I was hearing ringing, buzzing. And then 1 year later, I got my implant, and then I went into the deaf community. I felt that God must have had a reason behind this, or somebody must have had a reason behind this, and I need to figure out where my goals need to be. And I wanted to work within the deaf community. So I went around, spoke, and over the course of 30 years, I've traveled, I've spoken, and I've worked with universities and interpreter programs and the ACCME, which is the Accreditation Council for Continuing Medical Education. I said, you are approving courses and allowing continuing medical education providers to provide CME that's not accessible. So they said, okay, fine. They came back 2 weeks later and said, okay, we want you to present to CME providers on how to make your courses accessible under the ADA, not as a lawyer, but just how to do it and make it work. So I did that for 5 years. That was an amazing experience.
So you're a family physician practicing in urgent care. So tell me some of the biggest challenges that you have when you see patients in the exam room.
Before COVID, I would one-on-one with patients, I was fine. I relied on lip reading, I would ask questions, and I would make sure that I understood them by repeating specific things that they felt I understand what's going on. When COVID came, I needed to wear masks, and everyone all of a sudden felt like overnight had to wear masks and gloves and shields, which made lip reading a little bit difficult because you can't see through the mask. So I found out that there was a clear mask, and I advocated that the university provide them for me and for patients. But unfortunately, there was a huge shortage of supplies and PPE and equipment. So I could only have the mask for me and the interpreter that I had to work with. And I required interpreters now because I couldn't rely on my hearing or reading lips. So that was another challenge because I felt, will they still want me at the job? I know it's required by law, but at that time also it was department by department deciding, would you accept the accommodation or not? Thankfully, they did. And I didn't really have a whole lot of issues, but I needed to pick a team of 3 interpreters and some floats that would also cover when those 3 were not available. So the interpreters go into the room with me. They keep me updated on, you know, the environment, what's going on, some emergency up at the front desk, or there's a lab result that they yell out. And if they're ordering food, just simple things that you don't think about as a professional working with another professional who has a disability or a hearing loss, and how to be more inclusive of that professional so that they feel like a part of the group rather than standing out on their own. So that took a lot of teaching and learning amongst all of us. And right now, it's almost like the interpreters are just part of the team. Phone calls, I had to go through an interpreter as well, and that was pretty typical. So I really needed somebody that who could interpret at a higher register for language. So if I was talking to a physician on the other line, they could understand the vocabulary and what was required for me so I could better understand them in as efficient manner as possible.
Now, what about parts of the physical exam that rely on hearing, like using a stethoscope? How did you overcome those challenges?
So good question. I have an implant that's a Nucleus 22. And I got the N6, which is one of the newer implants that was compatible with mine because I got mine implanted in 91 and it's not been changed. So that type of implant allows Bluetooth. So it can connect to a microphone that can connect to a stethoscope called the Think One, which is basically a bell and is amplified. So that has really helped me to, and I'll get the stethoscope in just a minute, but that helps me to understand heart sounds, lung sounds. So it's actually very helpful. I can put it inside a plastic bag. I don't need to put anything in my ears or around my neck, so it doesn't interfere with PPE. And that's worked really well for me. There's a lot of interference because, you know, you also hear the shirt rustling and you hear other sounds in the room, but that can be modified as well. So I've been very happy with that. There are other deaf individuals who use other types of stethoscopes, and it works well for them. So if I can just demonstrate briefly, this is a remote for the microphone, which is a simple Bluetooth microphone, and I attach it to the stethoscope bell, and then I can turn it on, and you can see that the volume is up, and it's got different things that you can do. You can have it on like a telecoil, you can have it on a microphone and music. So theoretically, I could plug this right into my phone and be able to understand music or people on the phone as well. So it's a really neat tool that has made my life a lot easier.
Now, during your journey as a physician, has anyone discouraged you and said, it's not worth going through this path? Or have most of the people that you've dealt with along the way been completely supportive?
It's a good question. You will always meet people who will doubt you and not believe that you can accomplish things. And especially when I was going through university, just like with my dean of the department or of the university, and also many physicians tried to tell me, you know, Carolyn, you really need to think seriously about your career and what you're going to be able to do so you don't jeopardize patient safety. And I said, this is something I think about every day in my life. Am I jeopardizing their safety, or am I being of value to my patients? And there are other physicians who support me 100%. So I understand their perspective and their concerns, but I felt very strongly that I had a lot to offer the field. I could have gone into X-ray and radiology or pathology where I probably wouldn't have to like interact with people, but I'm a people person, so I enjoy that relationship with people. Plus, I can work with deaf patients without any troubles. But even with the mask and COVID, that created some challenges as well, even with deaf patients. So, because a lot of sign is facial expression and mouth movements. So if you're saying something is thin or fat, just for an example, you rely on this, and the mask completely covers all of that. You might catch some of the eyebrow movement, like, I'm sorry, I didn't understand, or something like that, but it requires a lot of experience and practice to figure that part out with the masks. So
now, for those listening to this podcast who are deaf or hard of hearing and interested in pursuing a career in medicine, what kind of wisdom or advice do you have for them?
For people who are deaf or hard of hearing, considering medicine as a career, I would say go for it. And if you have to fight, there are other people who have been there already and should not deter you from trying. Of course, if you're not qualified, that's a different story. But if you have the grades and you have the skills and you have a drive to be involved in medicine, nursing, or other fields, then go for it, because you will always find people that will try to like get you down or say, don't do it. But you need to listen to all the other people who will be supportive of your situation.
And my final question, what are some of your take-home messages that you want to leave with the Kevin MD audience?
I would say, don't give up. I would say, work with people. We are a medical team, and in teams, we can best take care of people. So basically, we need teamwork. If you exclude one person because of disability or because of whatever reason, then you're losing valuable input into decision-making, discussion, and how to make lives better for patients. And that's really why we're here. We're here to, we save lives, but we also help people get the best care that they can. Also, don't decline interpreter services. Don't ask the deaf person to pay for the interpreter, or ask the patient to bring their own interpreter. That's not legal. So overall, Diversity really makes the world a better place.
Carolyn, thank you so much for sharing your story, time, and insight. Thanks again for being on the show.
Thank you so much.